clipped and surgically prepared area over the joint is palpated and the needle is placed. There are a number of ways to inject the fetlock joint. This technique is into the dorsal joint pouch. The needle is placed underneath the extensor tendons. To ensure that the needle is in the joint, there are a number of techniques. Firstly, the end of the needle can be moved around very easily. Secondly, the fluid is injected very easily. And thirdly, joint fluid will come back when the needle is disconnected from the syringe. In this case, you can see the joint has become distended. There are a number of other techniques for injecting the fetlock joint. The second technique involves placing the needle between the palmar or plantar aspect of the cannon bone and the sesamoid bone. To facilitate this procedure, the limb should be partially flexed, and the needle is then placed in between the sesamoid and cannon bone. Correct placement can be determined by the fact that the needle will sink almost up to the hub. If the needle is in the wrong place, it simply hits bone and then has to be redirected. Remember that the only painful part of the procedure for the horse is pushing the needle through the skin. So if the needle does not immediately enter the joint, it may not have to be totally withdrawn. It could be withdrawn slightly and then redirected in the correct direction. Placement is confirmed by ease of injection, by the presence of fluid coming back when the syringe is disconnected from the needle, and by distension of the joint capsule. The final technique for injection of the fetlock joint involves placing the needle at the proximal extent of the sesamoid bone. In this region, care must be taken not to accidentally penetrate the digital flexor tendon sheath. Once again, placement is confirmed by ease of injection, the ability to move the end of the needle around within the joint, and the presence of fluid at the hub of the needle when the needle is disconnected from the syringe.